And of course, we have to introduce Miss Elizabeth David. And she is, the sunshine mixed with a little hurricane. So that brings smile to her face. That's good. That's nice, man. So Miss Elizabeth is a change management system healthcare leader and leader mentor for 25 plus years of experience in clinical practice, academic teaching, program development, and administration. Recently, been with Sir H.N. Reliance Hospital as the chief nursing officer and stepped up to be director, strategy and operational excellence. Now presently at Rajagiri Hospital in Kerala, Kochi. I think you are just 2 hours flying time from Mumbai. So,
I would love to come to Mumbai, Dr.
Yeah,
Rajkumar.
yeah, absolutely. So, Madam has, a bachelor's degree and a master's degree in nursing with specialization in medical surgical nursing from the prestigious LT College of Nursing, Mumbai, and degree of hospital administration from the well-known Tata Institute of Social Sciences. Tata Institute of Social Sciences is my alma mater as well. So, this one. And also she's a graduate from the Johns Hopkins Nurse Leadership Academy training program. She's a certified NABH assessor for hospital accreditation and nursing excellence. And she has built effective international nurse training programs for hospitals such as South Nassau Communities Hospital in New York and Mediclinic group of hospitals, Life Care and Net Care hospitals in South Africa. To ensure implementation of best practices, she has spent considerable time at the Johns Hopkins and has worked closely with some of the senior nursing leaders from Johns Hopkins. She is a consultant and speaker at various conferences, a visiting faculty for various courses related to hospital administration and quality management at the Tata Institute of Social Sciences. So welcome, Ms. Elizabeth David, for this wonderful panel discussion. And I would like to begin the panel discussion with, of course, what is happening in the wards. My first question would be to Dr. Dileep. What is the role of doctors in clinical documentation?
Good evening, sir. Good evening, sir. Good evening, audience. Sir, I think for me now there is no scope and space to speak anything more. After all, learned speakers has been explained and cleared all doubts. But I have to speak some lines. So as an administrator and before administration, I was in clinical field in the critical care area, now in the administration. So I feel the role of the doctors in medical records, it might vary according to physician specialties. But commonality across specialties is that physicians and surgeons primarily work to diagnose and treat injuries and illness. They perform and interpret diagnostic tests and recommended a plan of treatment. The treating doctors is the prime person who has to oversee the process and is many steps.
Doctor,
steps, physical examinations, treatment plans, operative records, consent forms, medication use, referral papers, very vital.
Dr. Dileep, your internet, I think, is a little problem. We have lost, I think, Dr. Dileep. So shall I move on to the next question? I think Ms. Ragini, please emphasize the importance and the purpose of the nursing records.
Good evening, everybody. The purpose and importance of nursing document, if we see, the nursing documents play a vital aspect in nursing medical documentation, because if you see, most of the documentation in the medical record is filled by the nurses itself, and the information in the nursing record provides a detailed account which the quality of nursing care provided or delivered to the patient's care, and also accurate and effective documentation ensures the continuity of care, which is very important for the patient. The nursing documentation is important because if you see, It is a permanent documentation. So, and continue documentation, which helps everybody who is working in the healthcare to plan the care of the patient. So, and also the nursing document we are using for the communication, as we can call as a hands-off communication, where we use different kind of tools, like we can say ISBAR. So if you are giving an hands-off communication through ISBAR tool, we need to have your documentation accurate. If you give your hands-off communication through your nursing documentation, then only you can say your hands-off communication is complete. Also, this nursing documentation we are used for the nursing audits, because every profession wants to improve a quality of their profession, same in the nursing. And also if you know the area of improvement, that everything we will come to know with the nursing audit. And nursing documentation always play an important role when you do a nursing audits for the patients or the area of improvement. Also, if you can say the educational purpose, also we can use a nursing documentation. This education not only restricted to the nursing, it is also for the patients, because when the nurse comes first and do the assessment or a daily assessment, as we can call as a reassessment of the patient, so then only we come to know what education we need to provide to the patient on the in the process of admission or at the time of discharge. So this is how the nursing documents are very important. See, one I wanted to share that if you want to see whatever treatment or whatever care you are providing to the patient, whether you have a successful care or you need to improve your care, for that also you need to have you have to refer in a nursing documentation. So for this, I would like to give one example. Like if you have received a patient as a pressure injuries at the 3rd degree, and you want to say that whether this pressure injury is deteriorating or it is healing, that you can see on a daily assessment sheet of nurses, where they are charting Braden scale on a daily basis. So like that, the nursing documentation are very important. You can use the nursing documentation for the research purpose and the prevent error and the duplication. So in the error and duplication, I would like to give an example. Like if one nurses will not sign after giving a medicine, so definitely it can be a duplication or error of medication. So the nursing documentation is so important to prevent an error or duplication of care to the patient.
Fine,
so
fine.
This is the how I feel that nursing documents are very important for the care of patients.
Yeah. Now, Dr. Dileep, you had left in between. So, would you like to complete your this one for most?
Yeah. Sir, one thing I want to clear: why medical records are important for doctors. One line, 2 lines I want to say. It is important for doctors to realize the medical records are become the single crucial and effective weapon. I am using the word weapon because now in modern era, no war can be win by any weapon. So in for doctors, only medical records can be used as a weapon. So to counter the false claims of the consumers when they file a case for the compensation. So
that sums it all, I think.
Yeah.
Yeah. Now, coming to Miss Elizabeth David, Madam, this in your experience, what are the most common type of documentation errors which you have observed? Because this is a very the vast topic. So I want, with your experience, you can throw some light on this.
Thank you, Dr. Rajkumar. Yes, we've got very weird experiences as far as the documentation errors that we can talk about. But just to kind of put it into a little perspective, I kind of classified them into 5 broad categories of errors that are possible. First one would be errors of omission, where you really forget to document something that is very important for a patient. For example, you forget to document the intake output chart, you forget to document the vital parameters, you forget to document a medication that has been administered or any treatment that has been given to the patient, which can also lead to a lot of errors as far as patient care is concerned. The next classification would be errors of commission, wherein you document erroneously. You make errors in documentation, such as you enter a wrong date, a wrong time, or the usual practice that you see in many hospitals is that nurses will carry a small sheet of paper. They would put all the vitals and all of that on the paper and then transcribe that onto a patient record. So invariably, you may end up documenting into the wrong patient record, or you may end up documenting the wrong value in a patient record. The next kind of error would be errors related to poor knowledge. Now here, I would like to, kind of talk about nurses being empowered. Whereas, because sometimes you may see a doctor who's prescribed a wrong medicine or a wrong dose, or some medications are not discontinued when they're supposed to be discontinued. But nurses are not empowered enough to, kind of have the discussion with the doctor or have the communication wherein you may prevent a medication error or prevent some error that can, go wrong with the patient. The other one is using wrong abbreviations. Like someone just mentioned in the previous sessions, you would find weird kind of abbreviations which are not enlisted in your hospital's record, probably not even in the world record of accepted abbreviations, The other one is related to poor language skills. Now, a lot of nursing, and you find a lot of medical professionals, they're not very adept with the English language communication, but they have to write their notes, obviously document in English. So which can also, if you make a wrong word, if you put in a wrong word, that can have a completely different meaning. So all these can lead to documentation errors. And one which is most important, which you see a lot again, which can be clearly prevented, is errors of negligence, which is purely because you are intending to do something wrong. And that is something which hurts more than anything else. So one of that could be, which you see many times, is that documentations are done in advance. Many a times you see the nurses documenting at 2 a.m. in the night. They would document what is supposed to happen at 5 a.m. in the morning. And then you probably have a patient just passed away at 4 a.m. and then you're sitting and trying to, work around that. So all of those errors happen. You make post facto entries into the patient record. There are times when you miss something and you just for the sake of not hiding that mistake, you would want to make a post facto documentation. You document something that is not done. Many a time vitals, I don't know how many times it is being actually recorded, actually monitored, but you just document it without knowing what is the real implication that can have onto the patient. And of course, a famous cut, copy, paste. So, these are kind of errors that you normally see in documentation.
Now, since you have enumerated so many of them, and then I'll continue the next question with you, because you have identified the errors. So then, what is the solution if you find for this? And what are the factors for this poor documentation, as well as can you throw some light on the measures which can be taken to mitigate such kind of documentation errors?
Sure, Dr. Rajkumar. I mean, if you look at the factors which influence poor documentation, the first one I would really want to talk about is inadequate nurse-patient ratio, because if you expect, at the end of the day, she's a human being, he or she is a human being, and if you're expecting them to take care of 10 and 12 patients at a given time, obviously the priority would be given to patient care rather than documentation. And world over, if you see, the nurse spends about 40 to 45% of her time in documentation. So, which is a cause of concern. The other one is, I think, from a very beginning, let's say at the school, at the nursing school or the nursing college, it's very important that nurses are taught, even for that matter, all medical professionals are taught about the importance of documentation. Many a times they come into the clinical practice without knowing why it is important to document. You talk about nursing care plans, which we, kind of have a lot of pride in talking about it. But the nurses who graduate are really not aware of what is a nursing care plan and why are you trying to do that. Distractions is another thing. When a nurse is working in a unit, I would want to salute every nurse who's working at the patient care area, because it is like a little pressure cooker. There's a lot of things that is happening around. When a nurse, I'm sure she does not get even 5 minutes to basically sit and do a thoughtful documentation. She's called by the doctor, she's called by the patient, she's called for a medication administration, she has to shift a patient. All of those things happen. So she does not get concentrated time to do it. So I think the solution to that would be that we try and work, structure the documentation.
These others mute, please. Mute. Yeah, please continue. Sorry.
So I think it's very important for us to train them from the very beginning at the school and college level. It's very important to train them what to document, because many a time you see long stories which are irrelevant. And at the same time, we need to try and bring in technology. We nowadays have a lot of technologies available, which will help in real-time monitoring of vital parameters, real-time documentation of vital parameters. So this will kind of ease the nurse and bring in a lot of efficiency, where she has to really concentrate and kind of really work around with the patient and with the other documentations, which are very important. So I think these are, so for example, I mean, in one of my previous organizations, what we did is we realized that the nurses are documenting, the system-wise patient assessment, doctors are documenting system-wise patient assessment, which is not required. So you have the nurse, she can refer to the doctor's documents. So we stopped the nurses from doing the system-wise nursing assessment. We got her to do other important parameters, such as education, such as, spiritual assessment, such as psychosocial assessment, the basic risk assessments. So it cut down the nursing documentation for initial nursing assessment by half. So if there are little things that we can do, I'm sure we will be able to make it a more meaningful kind of an activity for the nurse, rather than just a routine mundane activity, which is considered that way.
Fantastic. I think you have covered most of the things for the nurses. And Dr. Dileep, I'll come to you. And regarding the this one, for the doctor's clinical documentation, what are the solutions for that?
The solution for the first, doctor has to realize the responsibility and sense of responsibility towards the medical documentation, clinical documentation, because incomplete consent, verbal orders, incomplete discharge papers, and many things, sir. The nurses are depending on the doctors only. There are no fault. According to a clinician and administrator, the nurses are totally dependent on doctor. Doctors order, they are following. So doctor has to realize the sense of responsibility.
See, since you are in the administration position also, I'll throw a question to you.
Yes.
As an administrator, what steps you will take so that, they follow the steps, like, they follow that informed consent is the most commonest, thing which is missed.
Yes.
They are not taking, the surgeon is not taking, the anesthetist is not doing. So what will you do?
Sir, so I think use of advanced technology, where the chances of mistakes are less, and time also for the doctors is very, very important concern. So how can we reduce the time for the doctors to maintain the document? So I think if we can take the help of the advanced technology or implementation of the total electronic medical system.
So you say transform the system as well.
Yes.
Yeah.
And one thing I can this is Suganti, Madam Suganti Iyer is really the fantastic and very wonderful speech.
I'll come to that.
Thank you so much, Dr. Chauhan. Dr. Patil, and I think some.
Madam, I will humbly request you, please. I will request you in the mail. You will send your speech on the mail. I will try to circulate in my all clinicians. So they can realize the future consequences according to.
Absolutely. We'll work together on that. Yeah. Now, because of this, the paucity of time, I think, Dr. Suin is looking at me, when will this fellow end? Now, Ragini, a quick question to you. The principles for, nursing records.
Okay, sir. Actual principles, that is, everything is taught to all nurses in their nursing curriculum. But I feel that there should be a practical session. So what happens once they do the practical session, then only they will have an idea what principle they need to use in the nursing documentation. So there are principles for the documentation is been written. One is factual. Factual documentation, if you see, it should be the documents which you put inside the file. It has to be descriptive, objective information about what nurses see, actual assessed on the patient, and what they hear on failed. So this is how what practically they are doing with the patient. Then the documents should be accurate. Accurate means the institute has some accepted that abbreviation, symbols, system of measures that nurses should be trained on it, so they will have an accurate documentation when they are documenting things. Completeness, this is a vital thing, because if your documents is not complete, that is meaningless documents that nobody can use for anything. So I request everybody that whatever you're documenting, it should be a complete documentation that can be helped for every healthcare worker to plan the care. Current this documentation means there should be no duplication of the documentation. You have to document, and every part, whenever you do any practical session, any assessment of the patient, you need to have a proper documentation. Organized way means if you are putting something, it gives a meaning. So it has to be organized, and only it will have some meaning out of it. So these are certain principles which every nurse has to put when she is doing an nursing documentation. So these are the basic principles. There are so many. Once you are in the practice, you will able to do it. So this
Thank you. Thank you so much, Ragini. Thank you all the panelists. Now I would like to give a parting message for this this one. See, the importance of this in clinical documentation can never be more emphasized, because every person in the healthcare caregiver, he has to document the this one history in patient's clear client's words. It is called as 6 C's of documentation. In the client's words, that is in the patient's words, the documentation should be clear, clarity should be there, the completeness which has been emphasized, that should be there, then conciseness has to be there, then in the chronological order the document should be there, and of course the confidentiality of the record has to be maintained by by the organization. So these are the things which every healthcare caregiver has to observe when clinical documentation is being done. Of course, there have been star speakers and star performance today. The wonderful session from all the speakers. I thank all the speakers who have contributed in a very much timely manner. I thank all the attendees who have participated. Of course, I think we have touched upon the lives of each and every participant. We have done some justice to each and every one of you. And if we have done it, of course, if you want more, you please tell us and tell Kaho that you want more of the education series. Some of them have expressed already that we want a workshop of Suganti Iyer Madam. Of course, Dr. Sanjeev Singh, every speaker has done very well. Thank you once again. Thank you the delegates for attending. Participants, without you, this would not have been a successful program, and the response has been overwhelming. Then once again, I would like to thank Kaho, the President, Dr. Vijay Agarwal, the Secretary General, Dr. Lalu Joseph, then of course the Vice President, Dr. Samir Mehta, and the Secretary, that is Mr. Sunil Segar, of course Dr. Suvin Shetty, Dr. Anuradha Pichumani, and Dr. Anna George. Of course, thank the panelists, thank the speakers, thank my team, thank all the